Good afternoon and namaste everyone. I am Sulata Karki, working at HOD International as a researcher. Today I am going to present on a topic engaging community members in co-designing intervention to address non-communicable disease risks, especially in the urban context. And I am going to share the lessons that we have learned while forming the co-production groups. Yes, to start with the background and the context, urban population, as we all know, that face lots of non-communicable disease burden and risk factors. So it has been said by numerous factors, including the individual's behavior and a complex interplay of sociocultural, economical, political, and environmental factors. So to engaging community members as equal partners enables equitable and sustainable solution to address those risks in urban context. So this work is a part of a broader study, that is the participatory engagement for city community against NCD Risk, which applies a participatory learning action approach, where we have formed a community level co-production groups, and which these groups act as a co-researcher or a citizen scientist to understand and help researcher to broadly evaluate the community context, identify the critical issues related to non-communicable disease risks, and also to co-design the interventions. So this specific presentations highlights the key challenges we have faced while forming the co-production groups, and also I wanted to share the practical lessons that we have learned for meaningful engagement of community as a co-researcher. This study was conducted in 2 wards of Nagarjung municipality, Ward 9 and 10, including Ward 14 of Kathmandu metropolitan city, as shown in the map. So the formation process started with our initial proposal or thoughts of forming 3 diverse co-production groups, one with a mixed adult group of different age group, starting from age group of 18 years and above. Similarly, we also targeted to form a youth group of 18 to 24 years of age, and also a group of women with age group 50 plus or older women age groups. So we also aim to ensure the diversity of the membership in terms of age, education, sex, occupations, ethnicity, disability status, location, and also resident types, to form a diverse membership within these co-production groups. So the consultation process started with the iterative process of consulting with the local gatekeepers or the community stakeholders, which was then followed by the group discussion with the local gatekeepers, where we have engaged a number of representation from the community and the municipality or a local level, which included ward chairperson, municipality representatives from health facility, from school, local club members, etc. So initially what we did was we compiled a list of the existing co-production, existing networks or the community groups that has been functional or available in the community, and then we divided the study area into small sub-clusters so that we can pull the few members from each group to ensure the area-based representations, and then we contacted the lead or a chairperson of the group for the participant identification process. So as a part of the pre-formation engagement process, we approach the selected individual identified by local gatekeepers, and then we inform over the phone and also repeatedly visit to the community to help understand about the project, overall objective of its process, and time commitment through the entire 3 years duration of the project. We also assure and assess their willingness to participate in the study as a voluntary participation. And during the entire formation process, we always thought of forming the groups, ensuring the diversity for the equitable participation. So after then, we have formed a co-production group of 3 diverse groups, and then we hold a meeting or conduct a meeting with these 3 subgroups, where we formally discuss the study objectives, discuss the roles and responsibility of their participation in this project, and then agree some group principles, and also we obtain the written informed consent to work as a co-production groups or a citizen scientist in this study. So as a result, we form members of 53 members as a citizen scientist to work with us, with the researcher, and help in designing the interventions. So these are the pictures of those group. This table shows the summary and summary of the socio-demographic profile of the participant, where we have considered the diversity in terms of age, range, sex, ethnicity, religion, education, occupation, and also by resident types, where we have included members from the rented household, and from the education category there were also from highly literate groups to the illiterate groups. And also in terms of ethnic composition, we try to include the members from the minor ethnic groups as well. So the main challenges of forming the co-production groups and during this formation process was, in urban context, the population are often mobile and they are quite busy. So there was a frequent movement of their work for all the healthcare, and also there was the issue of the migration. Another challenge we faced was there was a low participation from the rented household, because they thought and they were quite reluctant because of their short-term stay and limited community interactions. Also, they were uncertain about their commitment to the project. Therefore, the key lessons we have learned was like utilizing the existing community groups and mobilizing the members from that groups was quite feasible to make co-production groups, and we also allowed some replacement over the time. Otherwise, it will be very hard to sustain the groups throughout the study duration. So another challenges we faced was like recruiting the youth participation, youth members in the group. Especially they were like busy with their school life or college life, and they were reluctant to participate in terms of their time commitment. And they have also frequently mentioned us that they are planning to move to abroad, so we couldn't commit to this project. So it was quite hard for us to include especially youth members as a co-production groups in our process. So one of the key lessons we have learned and what we have deal with these challenges was we adopt the peer-led process, so that we could so that the identified participant helped to recruit other participation. So peer-led process was quite useful. So another challenge was gender roles and imbalance that was like led by the male participation, which was often limited by the work responsibility, and women participation by limited by the household responsibility. And there was also initial discomfort among the mixed gender groups. So to deal with these issues, we have like gender segregated group discussion led by male researcher to the male participant and female researcher to female participation in the later stage when we deal with these challenges. And there was also difficulty in including the minority ethnic community, though we tried our best to include the participant from minor ethnic group, but it was quite hard. And also the representation in existing community groups were from the upper caste group. So the ultimate lesson we have learned was like the iterative consultative process with back and forth talks and informal formal conversation with local gatekeepers and community members, also like reaching out the individuals in the community. So it was a quite hectic and a long process to form the co-production groups. Another challenge was it was difficult to include the people with disability also, because they were quite reluctant to participate. And so to deal with these issues, we have like included caregivers. At least 2 caregivers are included as a co-production group members to include their voice in our study. And another biggest challenge was ethical concern, though some of the participants were quite interested to participate, but it didn't allow because of their age group. It was also a case of the disabled people who was interested but couldn't include in our groups. So another one of the key facilitating factors was compensation. We did provided few minimal incentives for their time commitment and also the communication allowances, so as to include the marginalized group in our co-production groups formation process. So finally, to conclude, formation of the co-production group in urban context with diverse participation and being inclusive was very hard, but we try our best to include at least few members from the diverse community in these settings. So finally, the take-home message is flexibility is critical. What we did was to balance or manage the urban mobile population. We prioritize their time against our. So we did the meeting, especially in the off hour. Above 5 or in the early morning, and also we have like conducted discussion in weekends, even in Saturdays. Mostly we have conducted the discussion in Saturday. So inclusive participation requires careful planning, intersectional considerations, and iterative consultation process, and also compensation has helped to engage marginalized community groups to include in our co-production group members, and also the shared ownership with the local municipalities has helped us to work closely with the community to help better understand the context and also to design the interventions, which we are planning to do in upcoming process. Thank you very much.
Sulta.